keep growing. So I would work in the emergency department, as well as I did procedures for GI. I was a procedural nurse there for
High intensity.
the GI lab. Yes, yeah, yes. And I also worked in the recovery room, the PACU, the PACU as it's known. So helping those patients that are recovering from anesthesia post-surgery. So just a breadth of different diverse critical care areas that you need to be sharp to take care of patients. And so that's a little bit about me as a nurse.
Right. And you mentioned energy in the beginning of that background. So tell me a little bit about that. Like, what excites you with working in such a high intense environment?
You know, I was trying to think of an answer for the audience and even for myself, but I think it's just really critical thinking is what it boils down to, using good common sense, your training, and really taking charge, making good decisions for the patient, for their family, for the physician, being that resource where everyone is coming to you and you have the answers, or you are helping direct in a decision, was empowering, you know, and so awe-inspiring. You know, it's humbling. And so that's what I really enjoyed. And I actually missed that interaction. But just the workload in terms of the patient care at the bedside, it does wear on the body, you know, and I'm not a spring chicken anymore. So I knew I had to look at other avenues for longevity purposes.
Right, right. Thank you for that. So one thing I've also been curious about is just when you mentioned like how it's the wear and tear of just like the work that we do. I know I'm more on the behavioral side of things. So you're in the physical clinician. As a clinician, name a couple self-care tips you have for clinicians out there in the field.
Oh my goodness. I just have to stop and say thank you to all of the frontline clinicians through this pandemic. The selfless, the tirelessness, you know, I have no words to appropriately thank you all for that, and witnessing it as a sideline supporter to remove barriers so that those in the front line can continue to do their job to save lives. It just never leaves me. So I just would be remiss if I didn't thank them. So thank you all. But in terms of your question, I think for self-care is pacing ourselves. You know, we just never know in healthcare what is going to get thrown at us. And if it is overwhelming, we are human, so we will feel it, but it's how we manage it, and just trying to just take a breath, sometimes we may literally have to step away for a few minutes to gather ourselves, meditate, you know, take your breaks, don't feel guilty. You are human, so we need you. So you have to do these little self-care acts for maintenance. And also mental health is so important. So taking time to really unplug and step away so that you can remain healthy, so that you're able to be there for yourself and your family and for the patients that rely on you.
Right. Helpful tips as far as, you know, the meditation and strategies have you used that you find effective?
Yes, like you say, it's important as clinicians that we just take a step back and not apologize and don't feel guilty for it. So for me personally, it may mean literally stepping outside, getting some sun on my face, and just letting it warm my body, and just, you know, just not just get all the thoughts out of our heads, and just be there and just pause. And that's okay. And then that allows us that space that we need to keep forging ahead and be able to keep piling it on, because it's not going to stop. So that's just how life is, unfortunately.
Yeah, yeah. And there's almost an acceptance piece to that's just how life is. And, you know, pausing allows us to gain back that rejuvenation to continue to be able to pile it back on. I like
Yes.
Thank you. So again, thank you for joining. And to close off, I really wanted to pause and ask you, what inspires you?
Well, other energetic people, other passionate people, other brilliant people. It's like a magnet for me. It's like I want to feed off of that energy and glean from it, and also share. Have a banter and share our knowledge and enrich ourselves and refine one another. I see, especially women, when you see a strong woman who is motivating and someone that you can really connect with. I can't wait till she's done speaking to go over there, meet her, and just pick her brain and just try to learn more how to keep self-improving. And so that I love. That is so attractive to me. So that, as well as someone who wants to learn, who wants to keep learning, who isn't just complacent and stagnant. So I don't take kindly to mediocrity in anywhere in my life, and never have, and I won't settle, so I never will. So I think that is also something that motivates me is being around. I love millennials. I love, yes, I'm saying it out loud. Because they bring a different perspective, and I love those that are older. They bring a different perspective. So even my own peer group. So different diversity in all fashions, all facets, I think is a beautiful thing, and it just refines us. So
so I'd love to continue doing this again one day. I like what you said as far as like energy begets energy. I think from the first time we've met, I've always had like that spark between us. And I think there's also a community into what you're saying, and just having those conversations, even the 10 minutes that we've spoken right now, I think it's already, okay, this is just going to bring an added positivity to my day. So thank you for you.